and you're leading some work around these issues in England. Could I ask you first, just for your comments around, there's been a lot of discussion about some of the ways of understanding this data, and a lot of focus on things like genetics and socio-economic factors. But what do you think is kind of missing from the analysis so far, and why does that matter for the NHS workforce?
Okay, first and foremost, thank you so much for inviting me. I'm really pleased to be here and to be able to talk to colleagues and members about this really important issue. And secondly, I'd like to say how very, very sorry I am for anybody out there that has lost somebody during this awful, awful time. I think we're all struck by it. It's all, you know, really very, very difficult for people, whether they're from white or black backgrounds. It doesn't matter. It is a really, really tricky and difficult time. I think the issue for Black and ethnic minority people is a really hard and difficult one to comprehend. And there has been a lot of talk about why this is, you know, people living in houses of multiple occupancy, they have high levels of comorbidities, they perhaps have, you know, are workers that are going to be facing the viral load much more than other people because they are in lower paid jobs. So you know, all of that is true. But the thing that is really not being spoken about as much as it should be spoken about is the levels of stress that Black and ethnic minority people have to endure in their everyday lives. You know, the life of somebody from a Black and minority ethnic background is not the same as the life of somebody from a white background. And, you know, we have so much evidence now to show that discrimination, racism, you know, being hyper vigilant all the time about what you say, what you do, how you go about doing it, actually has an impact, a physiological impact on the individual and their life.